When my journey to parenthood began, I felt very voiceless and invisible.
When Jay Wilson became pregnant, she developed high blood pressure or preeclampsia, a potentially dangerous but treatable complication.
The outcome of my previous 4 pregnancies resulted in 2 losses and 2 beautiful girls who are actually in the audience today.
Women of color in New Jersey are at greater risk for birth complications. They are 5 times more likely to die from it than white women, while black babies in New Jersey are 3 times more likely than white to never see their first birthday.
This is the widest racial disparity in the entire nation, and it is wholly unacceptable.
Today, Governor Phil Murphy signed a package of bills aimed to eliminate that racial gap and to improve outcomes for all mothers and babies. The laws will prohibit Medicaid and other health benefits programs from covering C-sections or induced labor when they are not medically necessary, establish a pilot program to improve birthing outcomes and reduce costs for Medicaid patients, and expand Medicaid to cover doulas. Doulas are often paid for privately by families or insurance companies, but they can be a life-saving advocate and educator for expecting moms.
And that's what they need. They need somebody who's going to speak up for them when they can't.
Chantel Pipkin recently acted in that role when one of her clients called from a hospital waiting room complaining of severe cramping.
She stood in the waiting room for about 6 hours without seeing a doctor. She called me and I came running to her. By the time I got to her, she started to bleed. I then went and got doctor's attention, and afterwards she lost her baby.
For Medicaid to cover doulas, New Jersey will need to apply for federal approval. In Newark, I'm Christy Duffy, Pix 11 News.